Meet Teresa, a 52-year-old immigrated to the U.S. 2 years ago and has been living in a crowded shelter. For weeks, she's lost weight, woken up drenched in night sweats, and battled a cough. Notice, Teresa has a productive cough, fatigue, low-grade fevers, night sweats, and lethargy that have built over weeks. Advanced cases can include dyspnea and hemoptysis. Key tests include 3 separate sputum cultures, a chest X-ray, and blood tests that detect immune response to TB. Interpret. Teresa has active tuberculosis, an airborne bacterial infection caused by Mycobacterium tuberculosis that mainly attacks the lungs. Normally, inhaled TB bacteria are walled off by the immune system into contained granulomas, latent TB, with no symptoms and no spread. But when the immune system weakens, the bacteria multiply, destroy lung tissue, and leave behind permanent cavities and scarring. TB cell wall makes it resistant to many antibiotics. Risk factors include crowded living conditions, limited health care, and poor nutrition. Respond. Treatment combines multiple antibiotics for 6 to 9 months, but up to 24 months for resistant cases. Close contacts with latent TB receive single drug prevention. Airborne precautions are required, and it must be reported to public health. Directly observed therapy, where a provider watching her take each dose, is standard to ensure adherence due to the high risk of drug resistance. Liver enzymes are monitored for medication-induced hepatitis. TB vaccination is not routine in the U.S. Reflect. With full treatment, Teresa's cultures turn negative, her cough and night sweats resolve, and she regains her weight. However, lung damage that already occurred is permanent. Untreated or incomplete treatment can allow TB to spread to the blood, spine, brain, or abdomen, causing serious complications. In summary, tuberculosis is an airborne bacterial infection that primarily attacks the lungs. Inhaled bacteria are either contained by the immune system or multiply and destroy lung tissue. Classic symptoms are a cough progressing from dry to productive, night sweats, weight loss, and low-grade fevers. It's treated with multiple antibiotics for 6 to 9 months under directly observed therapy. If you study to remember, you will forget. But if you study to understand, you will remember. Author unknown.